This video will demonstrate the documentation of infant feeding for a paediatric patient. This video will demonstrate specifically the documentation of breastfeeds, artificial formula and EBM via bottle within the IEMR. Prior to administering an infant feed, the nurse will need to review the enteral feed order in full, paying particular attention to the entire order, including the special instructions. If the mouse indicator is hovered over the word instructions, the entire special instruction will be displayed. Within the interactive view, the nurse will select Paediatric Systems Assessment. Infant feeding is not a default setting for Paediatric System Assessment, and therefore all paediatric patients receiving breast or bottle feeds will require the nurse to customize the Systems Assessment band to include infant feeding. Once customized and documented within, it will be available for future documentation by any clinician. The first workflow to be demonstrated is the documentation of a breastfeed. Firstly, select breastfeed and complete the relevant fields. Enter the duration of the feed. If clinically indicated, a breastfeed description could be added here. Now you can sign off the documentation. The duration of feed pulls through to the fluid balance band, however does not add to the overall fluid volume balance. The next workflow to be demonstrated is the documentation of a bottle feed of expressed breast milk. Complete the clinically appropriate fields. Select bottle and then select expressed breast milk within type of feed field. The nurse whom is checking the patient is receiving the correct EBM will enter their Novell ID and sign that they have witnessed the EBM. Enter the amount offered in mils and enter the amount taken in mils. Then you can sign off the documentation. The amount offered and amount taken pulls through to the fluid balance. The amount taken will add to the overall fluid balance volume. As you can see, the volume of feed has populated the oral intake. To identify the feed type that has been taken, right-click and add a comment to the cell. This comment can be seen by hovering on the field. Double-click the value and this will open the results details window, and comments can be seen within this window. The workflow for documenting a bottle feed of artificial formula is very similar to the EBM workflow, however, a witness nurse cosign will not be required. Documentation of consent for complementary feed for the exclusively breastfed baby must be documented in the appropriate cell within the infant feeding band. The workflows demonstrated in this video are for oral infant feeds only. This concludes our video demonstration for the documentation of infant feeds in the IEMR. Other videos available relating to paediatric feeds include ordering enteral feeds, paediatrics, and administering enteral fields via alternative routes, paediatrics. The Metro South digital website has useful QRGs relating to enteral feed and infant feeding, including infant feeding paediatrics, enteral feed bolus, enteral feed continuous, enteral feed nurse administration. Please contact your educators if further information is required.